Hi, Dr. Becky here with Del Mar Center for Behavioral Health. I wanted to do a short video today to talk about a concept that is super important, and that is social validity. And before you hit pause or stop and go to another video because you're not interested in being a researcher, I want to gently challenge you to stick with me for the next couple minutes, because I think what you'll learn is that social validity is of the utmost importance, particularly in applied settings. So if you're watching this video, you are either probably a parent of a child or teen with a disability who your family is participating in intervention services and supports, or maybe you are a clinician of some kind. So maybe you are a registered behavior technician or RBT, or maybe you are a board certified behavior analyst or a BCABA, and maybe you're a speech language pathologist or an occupational therapist, or you work as a counselor or psychologist. And so regardless of what position you play in a kiddo's life, you are part of making sure that their goals and treatment is appropriate. Appropriate. As a behavior analyst, that word is really challenging for me, right? Because what's the operational definition of that? And maybe your definition of appropriate might be different than mine, and that becomes acutely clear anytime we are maybe around somebody who has a different maybe repertoire of behaviors than we do, right? Maybe they yell in the library, and I think, oh, that's not appropriate to me, but it is okay to them. And so one of the ways that we determine appropriateness is in treatment is through social validity measures. And social validity is not just the appropriateness of the treatment, but appropriateness of the goal. So is it socially significant? Does that child need to know how to do X, Y, or Z behavior? An example of this would be we don't work on handstands in ABA services with Del Mar that are funded by medical insurance, right? Because we are required to only focus on medically necessary behaviors. And it doesn't really matter in the grand scheme of things whether a child can do a handstand. And so that is looking at the social validity as in the appropriateness of the goal, the social significance of that goal. How important is it for that child to need to know how to do a handstand, as well as sort of the appropriateness for something funded by a medical insurance, because there are people who use behavior analysis to help improve sports performance, and maybe in that setting it would be absolutely valid to work on handstands. So context is important. It's also about how appropriate is the treatment. So once we select a goal that it has social significance, how appropriate is our way of teaching that goal? So if I identify toileting in the potty, potty training as a socially important goal and therefore valid to work on in ABA, it's not just the goal that needs to be socially valid, but the way in which we teach that goal or teach skills to move towards that terminal behavior, that outcome. And so maybe we might give some reinforcement when they void in the potty, and we may do dry pants checks as well, so that we're also reinforcing the pants being dry as well as voiding in the potty. We're not going to shock the kiddo, right? We're not going to scream in their face, right? That would not be socially valid, because that doesn't happen. It's not just the goal, but also the way that we're going to get to that goal, so the way that we're going to teach those behaviors. And then the last component of social validity, according to behavior analysis, is what's the outcome of learning that skill or behavior? So what effect would it have on the individual learner if they don't learn those skills, or if they do learn those skills? So in the example of potty training, it may keep them from participating in certain educational environments that maybe they have the other prerequisite skills, so those early academic skills, but they're missing the potty training skills, and that is a set of behaviors that's required to move into a different setting. So it may be socially valid for them to learn this set of behaviors over others because of the impact that it can have. So social validity is language that's often talked about most in research settings, and I want to really encourage parents to ask about the social validity or the importance. Why are we targeting this skill over that skill? And for clinicians to really be thoughtful about when we're setting goals and developing intervention plans, are we meeting those 3 criteria of social validity, right? So the social significance, or how important that chain of behaviors is, or that behavior for the individual to learn. It's also the way in which we're going to treat that behavior, right? How are we going to engage in treatment protocols, or how are we going to teach it? That also has to be socially valid. And then the third piece is, what is the outcome of that treatment? So what would happen if the child or learner does or does not learn those behaviors? And if all of those are aligned, that it's important across the board, then we would say that we have developed some socially valid goals, and that we're teaching them in a way that's socially valid. I hope that is helpful, and thanks for taking the time to watch.